morning, everyone.
Good morning.
The government has been shut down for 10 days. Our men and women in uniform and hardworking federal employees are working without pay. Donald Trump can find the time to play golf, but he can't be bothered negotiating a bipartisan agreement to reopen the government and address the health care crisis that they've created, and House Republicans remain on vacation for 3 weeks. The American people are sick and tired of the chaos, crisis, and confusion that has been visited upon the country by Donald Trump and Republican complete control of Congress. As Democrats, our position remains very clear. We will sit down with anyone, anytime, any place, here at the Capitol or back at the White House to reopen the government, pay our federal employees, enact a spending agreement that meets the needs of the American people, and at the same time, address the Republican health care crisis that is devastating the American people. Question?
The president, you have said, should be involved with negotiations. He is headed out of the country. Do you have any sense of any negotiations happening, or what sort of timeline will be worked on, and any plea that you have for the president?
Donald Trump's strategy during this government shutdown that he has created has been to play golf and issue deepfake videos. Mike Johnson's strategy is to keep House Republicans on vacation. John Thune's strategy is to continue to do the same partisan thing over and over and over again and expect different results. That's legislative insanity. Our plea to our Republican colleagues is get serious about reopening the government. Let's have a conversation so we can find a bipartisan path forward to do the things that are necessary in a spending agreement to actually improve the quality of life of the American people and address the health care crisis that they've created, including by extending the Affordable Care Act tax credits. That's what we need to do right now so that tens of millions of Americans don't experience dramatically increased premiums, copays, and deductibles. That's going to bankrupt them or deprive them of the health care that they need.
We're already seeing paychecks missed, soldiers lining up at food kitchens. Are you concerned that this fight for health care that Democrats are waging here might end up hurting Americans the longer the shutdown drags out?
Republicans have the House, the Senate, and the presidency. They decided to shut the government down. Republicans in the House have decided to remain on vacation. Republicans canceled votes last week, they canceled votes this week, and now they've canceled votes next week. They're not serious about reopening the government. Republicans aren't even serious about paying our active duty troops.
But they have voted for temporary government funding legislation.
Republicans have voted for a partisan spending bill that continues to gut the health care of the American people and threatens to raise the cost of living on tens of millions of Americans in an environment where Republicans promised to lower the cost of living on day one. Costs haven't gone down, they've gone up. Inflation has gone up. The Trump tariffs are making life more expensive by thousands of dollars a year for everyday Americans. They visited chaos and crisis and confusion on the American people from day one of the Trump presidency. And now they've decided that they'd rather shut the government down than fix our broken health care system.
Good morning. When Democrats were in the majority in the Senate, there was sometimes a push to get rid of the legislative filibuster. Marjorie Taylor Greene and some Republicans have advocated for that. The Speaker apparently spoke to Ms. Greene about that very possibility. What if they were to get rid of the filibuster to pass that piece of legislation and, Democrats would be kind of left at the table here?
Marjorie Taylor Greene has made the observation that House Republican leadership and Senate Republican leadership are to blame for shutting the government down.
Thank you, Mr. Leader. Speaker Johnson was visibly upset during his press conference this morning. He was banging the lectern, blaming you and Chuck Schumer for troops not getting paid, and some of the outcomes that some of my colleagues have mentioned already. does that anger, does the emotion, the tensions that seem to be bubbling up, does it make it harder for you to negotiate or bring these Republicans to the table to have a conversation to move this thing forward, or should cooler heads prevail? Just how are you thinking about the emotion that seems to be taking over the hill over the last week?
We should keep the focus on the health, the safety, and the well-being of the American people, of hardworking American taxpayers, of working class Americans, middle class Americans, and everyday Americans. That's why we're fighting to lower the high cost of living. That's why Democrats are fighting to address the health care crisis that Republicans have created. That's the pain that Republicans have visited on everyday America. The largest cut to Medicaid in American history. Hospitals, nursing homes, and community-based health clinics all across America are closing because of what Republicans did in their one big ugly bill, where they rewarded their billionaire donors with massive permanent tax breaks. And now Republicans can't be bothered to even temporarily extend Affordable Care Act tax credits in order to make health care affordable for tens of millions of people who otherwise are going to face premiums that double, triple, or quadruple here in this country. That can't happen. This is the wealthiest country in the history of the world. And so I don't get why my colleagues on the other side of the aisle are getting emotional about their failed approach, their my way or the highway approach to governing, as if we're supposed to just bend the knee to extreme Republican demands, join them in passing a partisan Republican spending bill that guts the health care of the American people. It's not going to happen. Senate Democrats have repeatedly held the line. House Democrats remain unified. We were here last week. We're here this week. We will continue to be here to make clear to the American people, to our hardworking federal employees, to our men and women in uniform, and to the country, that we want to find a bipartisan path forward, that we want to reopen the government. We need to reopen it now. And we need to address the Republican health care crisis that's devastating people across the country, in rural America, in working class America, in urban America, in small town America, in the heartland of America, and in black and brown communities all across America.
Is there a question?
Thanks.
If Republicans were to commit to putting forward a vote, setting a specific date on voting on these ACA subsidies extensions, is that enough to get Democrats to reopen the government and come to the table on that?
Republicans have zero credibility, zero, on the issue of health care. For the last 15 years, they've done everything they can to try to repeal and displace the Affordable Care Act and tens of millions of Americans off of it, depriving them of the health care that they need, so that people all across this country, including in rural America, can see a doctor or visit a hospital. That's what this fight is all about. So what we've said to our Republican colleagues is we have to address the health care crisis that they've created decisively. That means legislatively, and that means right now. Thanks.
Question on Obamacare. Steve Scalise was just saying Obamacares have failed. Sinkhole needs to be replaced with something like HSA accounts. Can you react to that attitude coming from the Republicans on this side that Obamacare is not salvageable?
More than 70% of the American people want to see the Affordable Care Act maintained and the tax credits extended. And actually, our fight is for people in states like Louisiana. Because of what Republicans have done, hospitals and nursing homes and community-based health centers in Louisiana are closing. Healthcare is being ripped away from people in Louisiana because of what Republicans have done with their extreme one big ugly bill. Largest cut to Medicaid in American history. That's what Steve Scalise has done. That's what Mike Johnson has done. Throwing millions of Americans off of their health care, stealing food from the mouths of hungry children, veterans, and seniors in their home state. And all of this was done by Republicans to reward their billionaire donors with massive tax breaks. That's unacceptable. We can have that debate on the House floor. Unfortunately, Republicans remain on vacation.
Leader Jeffries, can you talk to us about the insurance companies? Are any of them responsible for the situation we're in right now?
is a bipartisan interest, I hope, in extending the Affordable Care Act tax credits, in addressing the massive Medicaid cuts that Republicans have inflicted on the American people. And I hope that there's bipartisan interest in trying to reopen the hospitals, the nursing homes, and the community-based health centers that are closing because of Republicans and their failed policies this year.
Republicans have canceled House votes for next Tuesday. Are you planning on bringing your full caucus back next week?
We have a caucus meeting at 12 p.m. We'll have something to announce shortly thereafter.
On Tuesday.
Kevin? We have a caucus meeting at 12 noon today.
At what point do you think it is too late to actually address these subsidies before that November 1st deadline? Especially when, and I'll put this in context, we have not seen really any movement from Republicans suggesting we're going to do anything until you agree to open the government. So at what point do you have to acquiesce in order to, protect the people and actually try to get something done?
We have seen rhetorical movement from Republicans, but actions speak louder than words. Sort of in mid to late September, what we heard from Republicans was that they passed a clean continuing resolution. Of course they didn't. It was a dirty partisan bill that continues to gut the health care of the American people. Then they tried to lie about the nature of the fight and pretend as if Democrats were fighting for anyone other than everyday Americans, working class Americans, and middle class Americans. But the country didn't buy it. Marjorie Taylor Greene herself doesn't buy it. She knows this fight is about hard-working American taxpayers. So then they moved off of that lie. And earlier this week, Republican leadership said, we are the party of health care. And all along, we intended to address the Affordable Care Act tax credits in October. Well, we're in October. Democrats are here. We're ready, willing, and able to sit down with our Republican colleagues, extend the Affordable Care Act tax credits, address the Republican health care crisis, reopen the government, pay our troops, pay our hardworking federal employees, and enact a spending agreement that actually makes life better for the American people. That's what we should be doing right now.
Thank you, Mr. Leader. You've repeatedly said that the bill is dirty and it's partisan, but we've consistently seen 3 Senate Democrats vote for this over and over again to keep the government open and move on to health care once the lights are back on. How are you leveling that this is a dirty bill when it's bipartisan and we have senators pushing to move on to this crisis as soon as the lights are on?
The overwhelming majority of the American people recognize that the Republican health care crisis needs to be addressed right now. The majority of the American people understand that it's Donald Trump and Republicans who have shut the government down. And the American people know that it's Donald Trump and Republicans who need to sit down and negotiate a bipartisan agreement in good faith, get off the golf course, come back from vacation, stop publishing deep fake videos, and get serious, because the lives of the American people are on the line. Democrats are serious about addressing this health care crisis, cancel the cuts, lower the costs, save health care. Thank you.
Thank you.
Thank you.